But they said that exercise is an integral component of pain management. But here's the problem. And this is a big problem, and this fuels a lot of misunderstanding and misapplication. That the type and the dosages aren't very clear, at least from an evidence standpoint. There's some proposed mechanisms of modulation of ascending pathways, facilitation of descending inhibitory pathways, and then also the role of muscle, skeletal muscle, as an endocrine organ. And there's some fascinating research being done, but that being said, we still don't know exactly how exercise helps, how it makes a difference. And we think we're helping. But here's the honest truth. And we have to be honest with ourselves about this right now, because we as physical therapists, as strength and conditioning coaches, we want to proudly be able to say, we're making a difference. What we do and what we believe is right. And we're making an impact here. You hear that all the time. I just want to make an impact. I still don't even know what that means. But the effect sizes of exercise on conditions like chronic low back pain, and I use chronic low back pain because it tends to occupy the bulk of the research right now, that's pretty small. The effect sizes for what we do, almost any kind of exercise, it doesn't matter what kind. No single form of exercise seems to come out as far superior than any others. Core training, yoga, walking, advice to stay active, strength training. And there's a questionable link between, here's what's really interesting, there's a very questionable link between the clinical outcome that we get with our patients. How do they feel better? Did the oswestry score go down? Did the visual analog scores, they go down? Those people aren't necessarily getting stronger and moving better. So that's another thing we kind of have to overcome in terms of what we don't fully understand. We'd like to think, I did this exercise, this muscle got stronger, therefore the patient got better. We really can't say that right now. So exercise we know seems to be beneficial, but not tremendously so, and probably not for reasons that we used to think. So how do we make sense of this? One thing I think we could do as rehabilitation professionals, as strength and conditioning professionals, is follow the trends that manual therapy's gone over maybe the last 15 years. And that's a transition from a biomedical model of how we look at things to more of a broader psychosocial framework. And that's a very vague statement. But I'm going to give you a couple of examples. We're going to talk about specificity. Strength and conditioning coaches, who knows what specificity is? All right. Zach, can I put you on the spot? What is specificity?
Specificity, making it specific to the task.
Yeah, we know this, right? Okay, so we do something and we get a specific response. Specific adaptation to an imposed demand, as we used to say. Okay. And then we're going to talk about another example of operators versus interactor. Now, I can't remember who coined this term. Something Jacobs? Yeah. Okay, but I'm telling you that this helps. One of the things that we've learned, and one of the big problems of manual therapy, orthodox manual therapy, is the principle of specificity. Specificity says we get out what we put in. I move L5 on S1, I'm going to get improved mobility L5 S1. I mobilize the shoulder in this specific direction, and I'm going to get a specific change in a specific direction of movement. We know now that's not an accurate representation of what actually goes on. We know that there are specific effects, and then we know that there are non-specific effects of what we do. So now, most of the time, we know that these things exist. And this has changed our perspective on how we provide manual therapy. At least it usually does. I went and taught a manual therapy course, or a fellowship course. I teach a course on strength and conditioning to manual therapy fellows. And there's still quite a bit of, hey, I push here, kind of tab A and slot B reasoning for manual therapy. But as a rule, we tend to be coming out of this. We're learning that there are widespread, system-wide effects for manual therapy.